Good morning and welcome to Focus Today. I'm Steve Johnson along with one of our favorite docs in the house who's here again. He is a doctor, he's in the house, so he's our doc in the house. Yeah, that almost sounds like a Dr. Seuss type of thing, but we're talking about another kind of a doctor, a medical doctor, Dr. Joel Klein with Ventana Wellness. And good to have you with us again.
Always a pleasure.
What have we talked about in the past? What has been the gamut of the topics?
What have I, we talked about cholesterol. I think we've talked about stress and hormones in particular, and the effects of stress on the body. And
what reminds me about that is thyroid, the thyroid conditions can impact all of those things as well, because we're also intertwined that way. And that's what you're here to talk about today. This is, I guess, Thyroid Awareness Month.
Yes.
I didn't know there was an official one.
I didn't either until last week, actually.
And you figured it out. Well, that's good. So we're going to be talking to him. If you've got some questions about it, you can certainly give us a call if you want, 776-5368. But let's just talk about this whole aspect of thyroid awareness. What do we need to know about it? We've heard about it, but I can't tell you that I know anything about how to have a good thyroid or how I'm destroying mine at this point.
Well, that's actually a very good question. I think one of the main things about awareness is that even the hormone experts, the thyroid experts estimate that we have a large population of people who have not been diagnosed with thyroid disease who do have a problem. Prevention, that's a good question. I mean, I have some of my own ideas with it. One of the main causes of an underactive thyroid is autoimmune thyroiditis. Again, and we've talked about inflammation, autoimmunity here, where the body is making antibodies against the thyroid tissue itself. And 5 or 6 years ago, there was a link made in a gastroenterology journal between that and celiac disease. We've talked a lot more about gluten and the inflammatory type of problems that happen with celiac disease, and it turns out that people with gluten issues have a much higher prevalence of this autoimmune thyroid problem. And the problem with thyroid is that it's very insidious. And missed by many doctors because of things that we'll probably talk about in a minute. But the symptoms can be subtle. They can be blamed on aging, typically blamed on aging or depression.
Well, and I was going to ask you about that because I think of that as being kind of an age-related illness, but that's too much of a default.
Not at all. No, I've seen young people. Now, the underactive thyroid, hypothyroid, yes, typically, although we've seen some not seen at least until people's 20s or 30s. Sometimes we see younger. I had a 14-year-old with an overactive, the overactive thyroid, which is much less common and pretty obvious to diagnose a lot of the times when you see people. It's a much more severe condition.
Now, and doesn't that cause growth problems if it's overreactive?
Or under. Right? Yes, or either way in children. Yeah, the thyroid controls is basically the accelerator pedal on your metabolism. So we need to put some gas in the car to get it to go, but we don't want to be putting too much in. So it really is the regulator of your whole metabolic rate. So either overactive or underactive can cause growth and development problems in children in particular.
All right, there's a lot to talk about with this in the few minutes we have, but if you want to call us, you certainly can. You can be a part of the show. You've got questions about something that you've heard about with thyroid or maybe your own situation, you can give us a call. 776-5368, that's the number, 776-5368. Dr. Joel Klein with Ventana Wellness is with us at this point. Do you find there are people who haven't realized that they have a thyroid problem and are diagnosed with that as having had that existing for some time, or do we pretty well know something's wrong from the get-go?
No, it's very insidious. In fact, I saw an older gentleman in the office the end of last week who over the past 4 years has had mental decline, and he really can't remember names, and it's been fairly dramatic over 4 years. Things like Alzheimer's and those dementias are a little bit more subtle and over time, and apparently, and he actually was at the emergency room, and it was his thyroid. The problem, it can be people. Actually, the people who come to me usually suspect that they have a problem, and have been told that all their blood tests is normal, so it's not their thyroid, and that's, I think, one of the greatest misunderstandings. We've been, I think, laboring under the illusion for 40 years of assumptions that were made back in the early 70s about the utility of the blood test that is now used, called the TSH, or thyroid stimulating hormone test. whose normals were arrived at by a statistical analysis of healthy people, and there's never been a study correlating how people feel and what their physical signs and symptoms are to that range. And doctors have been treating this statistically arrived at normal range for 40 years. It was assumed that it was self-evident that this is what was supposed to be done, and we find that in many, many, many people, especially people being already treated for a thyroid problem, you cannot just rely on the lab test. And I think this is the biggest misconception, but this is what standard medicine and endocrinologists mostly will say is, no, you treat the lab test. And people will say, but I'm still feeling poor. A lot of times in adults, since the symptoms can parallel depression, and since hypothyroidism can cause depression, it's frequently felt that no, you're just depressed, and people are given antidepressants. And then they still don't get better, and they keep trying different medications, and it turns out they do have a thyroid issue.
All right. 776-5368, the number that you can call to be a part of the show today, 776-5368. Lee is on the line with us, and you've got a question about thyroid medication. Is it because you're on medication right now, Lee?
Yeah.
And what specifically would that question be that you have about getting off it? You want to get off it, I assume.
Well, I'm wanting to know if it's a possibility. I had a goiter, and that's how we found out I had thyroid issues. I'm on Armour Thyroid, is what I take. I've been on it for about 3 years, and I'm wanting to know, does your thyroid come back and heal itself to where it can function without medication?
Not commonly, unless you get it in the beginning, has been my experience. The thing is, what's causing the goiter? And the medicine is not treating that. The medicine is helping to shrink the goiter and replace the thyroid hormone.
Right.
I find, again, some people, you can't find out with a lot of people what's really going on, but with a lot of people, it turns out it's this autoimmune problem that, again, has been related to gluten intake. There's some other things I do in the office with autoimmunity as well. But unless you're dealing with those kind of issues, and it's kind of hard to determine, I tell people if they have any problem, they have to get off gluten. It's possible to heal it, but after 3 years, it gets a little harder. Certainly after 5 to 10 years, I have not seen really people come back from that.
Okay, but if I came in and you could check this out and tell me if it's a possibility to go in that direction and pursue that?
Right. We could do the simple blood test for the autoimmune antibodies, and if they're there, I do have some other strategies of dealing with that I always want to hold out as possible.
Okay.
You know, I tell people I don't guarantee the miracles because I'm not the one doling them out. Right. But we try to create the opportunity, and we see how far we get with it. Yeah.
Okay, well, thank you very much. I appreciate it.
You bet.
Lee, thank you. Appreciate it very much. 776-5368, the number that you can call to be a part of today's show. We're talking with Dr. Joel Klein with Ventana Wellness. Marshall is on the line with us. You got a question about red palm oil. Is that right? What have you heard about that?
What have I heard about red palm oil?
Yeah, you had a question about that related to thyroid. What is your question related to that?
Not thyroid. It kind of takes the place of fish oil for your dementia and your Alzheimer and omega-3, right up there with coconut oil.
Coconut oil, you can't. Those are not. I don't know how that specifically relates here. I've never heard of red palm oil.
You haven't.
So maybe yes, but coconut oil is a different. It's healthy. It's good for you, but you can't substitute coconut oil for fish oil.
And palm are related.
I'm sorry?
Plants. Coconut and palm are related, and it's something that came up. I'm an old man, and in conversation with other elderly people, it's supposed to be the new to take a new thing coming out.
And you've been around a long time to see how many of those new things that came around have really worked, haven't you?
And I'm still hanging in there.
Right.
Have a nice day.
Okay,
thanks. Thank you, Marshall. I guess that just shows that sometimes, those common experiences are not necessarily scientifically based, so they do need to talk to their doctor when you hear those things.
And not even so. The problem with scientifically based with things, that's part of the reason people are different. And some of the all the science is a lot of times based on these statistical analyses, and not everybody fits those statistical models of normal. So you wind up, I treat individuals when I'm doing this because people tend to respond differently. So that can be part of the issue as well.
It'd be so much easier to have one thing that fixes everybody all the time, right?
Yeah,
silver bullet.
And if we were all exactly the same, it would be a very boring world, wouldn't it?
Yeah, that's true. 776-5368, that's the number Alice has called, and now Alice has hung up. So Alice, if you want to call back, you certainly can. We're talking to Dr. Joel Klein from Ventana Wellness about Thyroid Awareness Month and all the rest. Let me just ask you finally in this segment, this is a treatable condition from what you've seen? Somebody has a thyroid problem, it's highly treatable from your experience?
Highly treatable, although in my experience, currently medicine is using a one-size-fits-all, and they're using the regular, what's called levothyroxine, which is bioidentical. People say it's artificial and synthetic, but yes, but it's bioidentical. But that medicine has been thought that's all you need to do. I found that I have some people, I have to do all kinds of little tricks with different forms of thyroid hormone to get them to feel well. So again, there's a certain art to treating the individual rather than treating one size fits all.
Dr. Klein, you talked a little bit about the connection between thyroid and cholesterol levels and all of that. How closely are these aligned?
Very closely. It turns out that a low thyroid function will automatically raise your cholesterol independently. So there are many people who are probably being treated for high cholesterol, and what they really need is to have their thyroid treated, not to be on medication for their cholesterol.
Would that medication in any way mask it and make it look like their cholesterol is being brought down but not address the thyroid?
Of course.
Is that what, okay. So
right.
it could address, it could actually bring the cholesterol down then?
Yes, those medicines will lower the cholesterol. The statin drugs will lower it no matter what the cause. Because they block the production of it. But if the cause is actually the thyroid, I have had people drop 30, 40 points on their cholesterol by treating them for thyroid. Now, usually I won't do it if they don't have any other symptoms of thyroid. If they're not, we're looking at fatigue, weight gain, hair loss, dry skin, dry brittle hair and nails, constipation. These are the typical thyroid symptoms. So I won't just treat high cholesterol, although I've had patients. I had a patient, I don't know, this is like 20 years ago, who had a very high cholesterol. We couldn't get it down. I sent him to the cardiologist, and the cardiologist put him on thyroid. So I found out that there was hypothyroid. So it's at least worth doing the testing. For anybody who has a high cholesterol, really should have the thyroid tested to make sure that it's not a thyroid issue.
All right. Is that something they should ask their doctor to do? Or is the thyroid test a part of a cholesterol test anyway of your blood?
No, it's an independent test. And
can you request that? Is that something the patient can do as a matter of course?
I guess it depends on their relationship with their doctor. I would.
Does it cost extra? I mean, is that an expensive thing to do, or is that just as
no,
easy?
but typically, none of these lab tests, if you're paying cash, are cheap. But most of the time, it's going to be if you have that right diagnosis on there, that'll be covered by insurance.
Well, that's a good thing. I think sometimes we think, well, everything that's going to be tested will be, but it may be something totally unrelated.
Oh, not at all.
Or that we think is unrelated.
Oh, people come and tell me I want everything done. Says, well, I got about 2,000 labs in my lab manual from whatever lab here, so you can't have everything done. So no, they'll do just a basic screening panel looking at blood count chemistries and the cholesterol panel. In fact, it's been not recommended to routinely check thyroid, and I think that may be a reasonable thing. You don't want to check it on everybody, but anybody who's got any kind of clinical suspicion of any of those symptoms, the lab abnormalities, absolutely should have it tested separately.
All right, great. 776-5368, the number you can call to be a part of this segment with Dr. Klein. Frank is on the line with us. You got a question about iodine, is that right?
Yes, good morning, Steve and Dr. Klein.
Good morning.
I just was wondering how wise it is or effective to introduce iodine or potassium iodine into your diet as a kind of way of maintaining your thyroid.
I wouldn't do it as a preventative necessarily. I mean, unless you're not getting iodine from anything like leafy greens. Seaweed is a great kelp, great source of iodine. And I wouldn't say it's necessarily a preventative, except, yes, if you're talking about iodine deficiency. But since many people, again, have this inflammatory problem with their thyroid, iodine's not going to treat that. So I wouldn't just do it as a preventative. There are so many things we could take because they're a good idea that I think we can overwhelm ourselves with supplements. But if you're getting enough leafy greens and these types of things, I don't think it's necessary. Some people with a very mild hypothyroidism can take an iodine supplement and then actually it will help the thyroid. But that's not everybody. It's not a panacea. But for some people with mild hypothyroidism, it can help.
Okay, thank you.
Thank you very much, Frank. Appreciate it. 776-5368. Talking with Dr. Klein from Ventana Wellness. And online with us is Eric. Good morning, Eric. What's your question today?
Good morning, Dr. Joel. Thanks for taking my question.
Sure.
You mentioned something about autoimmune disorders and their relation to gluten intake, which could end up mistakenly leading people down the path of thinking that their thyroid is messed up. Can you talk just a little bit more about that and explain gluten intolerance and how that's related to thyroid? I've never heard that connection before.
Oh, yes. Well, the alternative doctors have been looking at this for 40 years, but there was an article published in Scientific American in 2009 showing the link of gluten intolerance and autoimmune diseases in general. It's what's called the leaky gut hypothesis, where the gut, having been disturbed by antibiotics, bad diet, chemicals, and other things, will then leak proteins through the wall of the gut into the lining where your immune system has a huge proponent of inflammation-producing cells. Gluten is the primary culprit there. The dairy, corn, and soy can also play a role. And what we find when we trace people's histories back is that a lot of people with autoimmune disease, it started in their thyroid. That was the first thing that showed up, and they were diagnosed with hypothyroidism, and then 5, 10, 15 years later, the same process goes on to generate other autoimmune problems like rheumatoid arthritis or lupus. So there's a clear link with gluten and autoimmune disease.
Well, and that could mistakenly be diagnosed as a thyroid problem as well?
Not mistakenly. No, that could be the cause of somebody's thyroid problem. They can be diagnosed as hypothyroid by lab test or clinically, and nobody does the test for the autoimmune antibody, so they don't realize that the cause of their hypothyroidism is the autoimmune process.
I see. Awesome. Thanks so much. That was really helpful.
Sure.
Thank you, Eric. Appreciate it. 776-5368 on Focus today, talking to Dr. Joel Klein from Ventana Wellness. And Kathy's on the line with us. You have a follow-up question to kind of the whole thyroid cholesterol issue. What is that question?
Yeah, I was recently tested for just my whole blood workup thing, and I'm a bit low in thyroid at 2.4, and my cholesterol is elevated. I was put on Cytomel and immediately just had really bad reactions where I'm just totally dead tired.
Right.
So it did exactly the opposite of what
Right.
we thought it would do. Do you have any comments
Yes,
on
well,
that?
Cytomel is the active form of thyroid hormone. It can be very powerful. Some people it's too strong for, and taking Cytomel for you was like all of a sudden flooring your gas pedal with your engine in neutral. So your engine was revving at 7,000 RPMs, therefore tiring out the rest of the engine. So it's like you were literally like going in circles. It may or may, again, relying exclusively on the lab test. I don't know which 2.4 you're talking about, which lab test that is. It doesn't sound too off to me if it's the TSH or the free T3.
It's the free T3.
Okay, well that doesn't really sound, yeah, it's a tenth of a point low. Again, that's where I've gotten to the point I use the lab test, but I wind up treating people and not the lab tests. Because in somebody like you, it turned out that probably wasn't the right way to go. Now, whether Armor would be different, which has less T3, or that might set you off. I have people with high TSHs and they feel fine. And the doctors say, oh, but the lab test says you're hypothyroid. You give them the medicine, they feel worse. That TSH may be normal for them. That's the problem. We have this statistical normal that's 95% of, or 90% of people supposedly, and we shove you into that statistical normal, and we don't know whether you fit there or not, and your body clearly said, don't do this to me. It may be that the thyroid is related to the cholesterol. In your case, it may not. So it's not all these cut and dried, very easy answered issues. It needs to be taken in context with the whole picture.
Right, yeah. Okay.
Wow. Thanks, Kathy.
Thank you.
Well, that question there really opens up the gamut of options and possibilities. There's, like you say, there isn't one single answer for every person that way. Where would you suggest is a good place to go for more information on any thyroid-related question that people might have, and get the right information? Because we've heard how conversations one might have over coffee might not be the best.
You won't. My experience is there are all these books out there about thyroid treatment recommending different approaches, this and that, and I find, as I tell patients, for every book out there, I find somebody who's come into my office who's made a liar out of the author. Nobody's one method applies. So I haven't really seen anybody put together something that that really talks about here's an approach you can use, and there's these people and that people. Everybody has their pet approach to treating thyroid that I said works for some people but not for everybody. The key is finding somebody who's open to at least discussing it, and unfortunately most physicians are practicing what they have been taught by other doctors and teachers, and I think if they find out if they actually try to apply some principles and look at that, they'll actually and listen to their patients. Their patients will tell them different than what they've been taught. And it's kind of learning by experience. I haven't seen anybody who's written a book about how to do this specifically, because the conventional medical is you use the levothyroxine, you treat the normals of the TSH test, and that's the end of it. And anybody who preaches against that is going to be up against some big resistance, because that's what's been taught and told for 40 years.
This sounds like one of those medical areas that still has a lot of work to be done in it before there's a universality of agreement.
Well, it needs a lot of work, but unfortunately, according to, in the conventional community, the book is closed.
Wow.
Now, we know why this is, and if you don't fit, then there's something else wrong with you. And again, since 90% of hypothyroid patients are women, there's still a medical bias it's very subtle against women that goes back to hysteria back in the 1800s, and most women are told, no, you're depressed, you need some Prozac or something else, because as far as they're concerned, the book has been closed for 40 years. So there's not openness to discussion about it.
All right, well, one thing you can do is find your own way to celebrate Thyroid Awareness Month. Thanks for being with us, Dr. Joel Klein from Ventana Wellness.
Great.
Thanks.
Thank you, Steve.